and welcome to the European Congress of Rheumatology 2021. So this year we'd hoped to be in Paris, but we find ourselves again enjoying a virtual format of the Congress this year. We're delighted to have you join us here on EULAR News and EULAR TV, and really hope that you'll enjoy the content of this year's Virtual Congress 2021 over the next 4 days. My name is Mrinalini Day. I'm an academic clinical fellow and rheumatology registrar based in Liverpool in the UK. And this year on EULAR News, I will be joined by my colleague, Tu Kragstrup. Hi, Tu.
Hello.
Hi.
Mrinalini. So good to see you.
Good to see you as well.
Yeah, so my name is Tu Kragstrup. I am an associate professor in immunopharmacology at the Department of Biomedicine at Aarhus University. And I'm also an MD and training in rheumatology, currently at the Department of Rheumatology at Aarhus University Hospital in Denmark. So let me just briefly go through today's program. So today was a very packed program from the clinical sessions. I will highlight both the how to treat and the what is new sessions on SPA. And there was also a very interesting session called Treating SLA to Target. Furthermore, there were 2 Part A sessions, there were 2 practical skills sessions, and there was a EULAR project session. In the basic research session, I want to highlight a session called New Perspectives on Therapeutic Immune Tolerance. And there was also a very intriguing session called New Toys in Rheumatology, Single-cell RNA and epigenetic sequencing, the Holy Grail. Finally, I also want to mention the Young Rheumatologist session and this new session, innovation session called EULAR and the EMA, from approval to safety and drug supply. So, Mrinalini, we both went to the opening plenary abstract session.
Yes, absolutely. So a highlight of the opening day of EULAR is always the opening plenary abstract session, and this took place this afternoon, and it covered a wide variety of topics, everything from patient education to vaccine safety to immunophenotyping in rheumatoid arthritis. Between me and Tu, we will try to bring you some of the highlights. So the first presentation which I'd like to discuss is OP0006, which covered results from the COVID-19 Global Rheumatology Alliance Registry. This particular abstract focused on the association of baseline use of biologics or targeted synthetic DMARDs with COVID-19 severity in rheumatoid arthritis.
Yeah, so the COVID-19 Global Rheumatology Alliance Registry it's already produced some striking results on risk factors for severe COVID-19 in our patients.
Yes, absolutely. And some of these results were presented previously, such as at ACR as well. But this particular study included 1,673 patients with rheumatoid arthritis on these drugs, and also looked at these patients when they got COVID-19. And the results showed that the baseline use of rituximab or JAK inhibitors was associated with worse severity of COVID-19 compared with the use of TNF inhibitors, particularly pronounced for rituximab. So this is really important evidence contributing to our ever-expanding evidence base on immunosuppression use in the context of COVID-19, something that obviously continues to evolve. Now, Tu, you actually wanted to cover one of the other abstracts in this session. So which ones particularly struck you?
Yeah, thank you. So I actually picked 2 abstracts from the opening plenary abstract session. The first abstract is our presentation 0010, titled Efficacy and Safety of Fecal Microbiota Transplantation for Active Peripheral Psoriatic Arthritis, a randomized sham-controlled trial. And this was presented by MD, PhD, Maja Skov-Krausnes. So how do you target the gut joint axis in psoriatic arthritis? The researchers here tried to do this with fecal transplantation. So does it work? Unfortunately, no. So this group of researchers evaluated efficacy and safety of fecal microbiota transplantation in psoriatic arthritis. It was a double-blind, parallel group, sham-controlled superiority trial. The study population consisted of 31 active peripheral PSA patients with at least 3 swollen joints despite ongoing treatment with methotrexate. The study intervention was either gastroscopic guided fecal transplantation or sham transplantation into the duodenum. So the primary efficacy endpoint was the proportion of participants experiencing treatment failure through 26 weeks.
So, Tu, you said it was a negative trial. What were the results?
Yeah, so unfortunately, as mentioned in the introduction, treatment failure in the fecal transplantation group was 60%, and in the sham group, only 19%. So in fact, fecal transplantation was inferior to sham in treating active peripheral PSA.
So does that mean that fecal transplantation should not be tested any further in the context of psoriatic arthritis?
Yeah, so one of the limitations was obviously the significant clinical improvement observed in the sham group. But definitely fecal transplantation does not seem to be a useful approach in psoriatic arthritis. So the next abstract I want to highlight is our presentation 0011. And this is titled Integration of Flow and Digital Cytometry in Early Treatment Naive Rheumatoid Arthritis Identifies Distinct Immunophenotypes of Peripheral Blood and Diseased Tissue. And this was presented by MD PhD Felice Rebelese. So, Mrinalini, do you know what a CXCR5 negative, PD1 high, ICOS positive, CD4 positive T cell is?
I can try, but it's not normally something that I talk about in the clinic with my patients.
Exactly. So this is basically flow cytometry terminology for a T peripheral helper cell. So this T helper subset came up in the unbiased analysis in this pathobiology of early arthritis cohort in this study. So the big question is now, can these cells, the T peripheral helper cells, can they bring sort of the same treatments to patients with rheumatoid arthritis like the Th17 cells have done for patients with psoriatic arthritis?
So I'm familiar with the early arthritis cohort. This is a multi-center study in the UK with synovial biopsies in early rheumatoid arthritis.
Yes, exactly. So this study has already led to the identification of synovial patterns and association between genes and clinical disease aspects. So all this is already publicly available at the Pathobiology of Early Arthritis Cohort website. And this is a very nice interactive resource. And I will highly encourage anyone with interest in RA pathophysiology to go explore that website. So obviously this pioneering work with synovial biopsies will keep giving us information about the synovial alterations in RA. And here the researchers sort of build on this previous data and add flow cytometry of the peripheral blood mononuclear cells.
So what did they find?
So among the T cell subsets, this T peripheral helper cell came up, and it had really strong positive correlations with inflammatory markers, disease activity, ultrasound scores. And then as mentioned, these cells are characterized by being CXCR5 negative, PD1 high, ICOS positive CD4 T cells. And when knowing this, the researchers could use these characteristics to specifically look for the T peripheral helper signature also in the synovium. And here the baseline synovial T peripheral helper signature was significantly higher in patients who ended up needing biologic DMARDs. So very interesting. So this is not only very insightful for basic scientists, but also actually holds promise for clinical use in the future.
Great, thank you too. One of the other abstracts in this session, moving away from the more basic pathophysiology of RA and to the more clinical side, is on the association between passive smoking in childhood and adulthood and rheumatoid arthritis, and this was OP0012. And these were the results from the French E3N EPIC cohort study. So smoking has long been known to be a risk factor for anti-CCP positive rheumatoid arthritis, but this study was looking into the effects of passive smoking, and it looked at almost 80,000 French women, and the results demonstrated that passive smoking in childhood or adulthood increased the risk of rheumatoid arthritis, especially among never smoking women. So really adding to our evidence base in this area, and of course has real clinical implications for our practice. Now, moving away to something completely different, going to the translational session. So I believe that you attended this today. What were your highlights from this session?
Yes, thank you, Rinalini. So the final study that I want to mention here on EULAR News Day 1 comes from the translational session, and this was titled "Of Mice and Men: Insights into Pathophysiology of Rheumatoid Arthritis and Spondyloarthritis." And the abstract that I want to highlight is oral presentation 0030, and this was presented by Professor Ian McGuinness. And this is a report of proteomics analysis of the SELECT PSA 1 phase 3 study, which was comparing upadacitinib with adalimumab in psoriatic arthritis. So the most informative studies you can find in translational research are typically when a very well characterized patient population is analyzed with unbiased methods. And that is exactly what we have here. So then you even add the EULAR president, Professor Ian McGuinness, as presenter, then you have a really informative and really entertaining talk that just puts all these basic findings into clinical perspective. So the aim was to determine the biological pathways modulated by upadacitinib compared with adalimumab in patients with psoriatic arthritis. And they did this via the evaluation of approximately 100 plasma proteins associated with inflammation. And interestingly, the two drugs both modulate shared and distinct pathways. So both treatments resulted in the downregulation of interferon, IL-6, TNF-related protein biomarkers. But in addition, upadacitinib resulted in distinct downmodulation of T-cell associated, myeloid cell associated proteins, whereas adalimumab resulted in specific downmodulation of a subset of neutrophil associated proteins.
And in what way is this useful?
Well, so these findings are very much in line with clinical observations that some targeted drugs show efficacy in overlapping diseases, while some drugs are specifically more effective in only one or a few diseases. And we will learn to understand this better by studies like this. Studies like this can sometimes also potentially help us predict side effect profiles and guide toxicology programs. So, Rinalini, you went to the Young Rheumatologist session also. This is co-arranged by Immunet. So we're both affiliated with Immunet. So this is the emerging EULAR network. So we primarily make activities, initiatives for the young rheumatologists in the EULAR countries. So what will you take from this session?
Yes, so this was a really fascinating session, and as always, Immunet put on really great sessions for emerging rheumatologists. So this one in particular was on the implementation of immunological knowledge in rheumatology research and practice, and I particularly enjoyed Professor Osbelt's talk on the principles and practicalities of translational research, and she exemplified this through some data from the early development and clinical trials of targeted therapies. She highlighted the importance of patient stratification in rheumatology clinical research, as well as the analysis of synovial tissue, in addition to responses in the peripheral blood with single cell analysis and well-defined clinical cohorts. And if you missed it, I'd strongly recommend going back and catching that session on demand. It was really good. So those are my key highlights from today. Tomorrow is going to be another packed program, and I'll be covering some of the rheumatoid arthritis abstracts, the session on vaccinations and the immunosuppressed, and also finding out what is new in giant cell arteritis. So Tu, what sessions do you plan to attend tomorrow?
So tomorrow I look very much forward to 2 sessions on rheumatic immune-related adverse events from immune checkpoint inhibitors. And I am also very intrigued by a session called Bedside to Bench.
Right.
Any final comments, Rinalini?
Yeah, so I think one thing we'd both like to also highlight to anyone watching, particularly if you are a member of Immunet, is that we are running special interest groups, which both myself and Tu are helping to organise, and these are for a number of young rheumatologists who wish to hear more from one of the distinguished speakers at EULAR. So, for example, if you have an interest in epidemiology, do join me tomorrow at 9:45 Central European time, where we'll be joined by Professor Georgi Nagy and discussing his work on difficult to treat rheumatoid arthritis. And similarly, if your interests lie elsewhere, for example, in connective tissue disease or in another part of the rheumatic diseases, do check out your relevant special interest group and join that session if you're interested. So we hope to see you tomorrow for another edition of EULAR News or at one of the other sessions. And we really hope that you enjoy the remainder of day one of the Congress. Thank you for joining us.
Thank you. Bye-bye.
Bye.